Hey. All right, just an update for everybody. We will be planning to get started slightly after 1 o'clock, so please be patient with us. Thank you, everyone.
All right, everybody, good afternoon and welcome. Especially on this beautiful, what was going to be I guess, rainy day. Look, it's gorgeous. It's absolutely sunny and beautiful outside. So I'd like to call this special meeting of the Kane County Board to order, please. It is Wednesday, March 27th, 2024, and it's 1:02. So clerk, would you please call the roll?
Ellen? Ellen, are you present? Bates?
Bates here remotely.
Berman?
Berman's here.
Doherty? Doherty? Davis?
Davis here.
Ford?
Ford here.
Gums?
Thumbs here.
Iqbal? Juby?
Juby here.
Kenyon?
Here.
Caius?
Present.
Leonard?
Leonard here.
Lewis?
Lewis here.
Linder?
Linda remote.
Thank you. Molina?
Molina present.
Roth?
Roth here.
Sanchez?
Sanchez present.
Silva?
Silva is here.
Strathman?
Present.
Surgis? Tarver? Mr. Tarver? Tepe?
Tepe here.
Williams?
Williams here.
Young?
Here.
And Madam Chair, you are present with a quorum.
So I'd
Madam-
like to have permission to bring Mr. Ford in, Mr. Linder in, and Mrs. Bates in remotely, please.
And
Deborah,
Is Mr.
Deborah Allen
Davis here?
also, please.
Yeah, he's here.
Oh, and Mr. Davis.
Deb Allen.
Yes.
Deb, are you here?
I am. I'm sorry
Okay.
for not being there for roll call.
Okay, very good. Thank you. So we have Allen, Bates, Ford, Linder, Davis, and Mr. Doherty. Mr. Doherty is not here. And Mr. Tarver is not here. Do I have your permission to bring everybody in remotely, please? Okay, very good. Thank you. All right, Ms. Strathman?
Would everybody please rise to say the pledge? I pledge allegiance to the flag. Today I'm going to take this off while I do this part.
Thank you.
I have asked to have Ed Hunter from Elgin to do the invocation for us today. I met Ed through some health committee meetings, and he has been a chaplain and mission officer and support for community health outreach for 36 years. He's served at St. Joe Hospital. He retired in January, but remains a volunteer. He served many other places besides just St. Joe as well. He has been a supporter and partner with health departments since 1988, both professionally and personally, and on an advisory committee for the last 5 years. He sits on various community boards in the county, working with human services agencies since 1996. And he has collaborated with the county and hospitals in joining together needs assessments and implementations of the process. And I've asked him to lead us in invocation this morning or this afternoon.
Very good.
And he is he's with us on Zoom.
Oh, okay. Where is he?
Yeah, there he should be there.
Hello, Madam Chair.
Yes.
There you are. Okay.
Yeah.
Hi, Ed.
Can you hear me?
Yes,
Yeah.
absolutely.
Okay. Greetings, everyone, on this.
Hold on just a second.
Okay. Ready?
We're going to make there we go. There we go.
There you are.
Well, greetings again, everyone. So thank you for the opportunity to be with you and share a brief thought. For me, an invocation is a chance to stop and to take some time to center ourselves, often on important issues that require discernment. And so a time of reflection. And so I thank you for the opportunity today, together in a spirit of generosity. May we always honor one another by keeping an open mind. May we listen with an open heart and open mind. We are thankful for this day that you have given us, for its blessings, its opportunities, and its challenges. May we appreciate and use each day that comes to us We pray for strength and guidance for each day, for each day's duties, for each day's problems and concerns and opportunities. We ask you to guide those who, as government leaders, make their daily decisions that affect us, so that their efforts may be motivated by the same great rule of charity and goodwill. May we be challenged to give each other and to give ourselves always the best, as we ask and pray that we are mindful of every opportunities to render our service to fellow citizens and to our community at large, keeping in mind always the enduring values of life, exerting our efforts in those areas and on those things upon which future generations can build with confidence. Let us continue to strive to make a world a better place. Bless us and guide us in this discernment time together. Amen.
Amen.
Thank you so much.
Lovely. Thank you, Cheryl.
Good choice.
Very well. Thank you, Mr. Hunter. Well said. Thank you so much. All righty. May I put the agenda back up, please? And I don't have my notes. So we're on to public comment. I usually have a script that I read that I don't have in front of me. So I will go from memory. That's what I was looking for. We have two opportunities for public comment. The first is on topic, and that is a half an hour. We have 5 minutes per speaker, which will give us about six speakers allowed to speak during this period of time. For off agenda, which follows directly after on agenda, you'll have a total of 15 minutes of which to speak, which is 3 minutes per speaker for a total of 5 speakers. We ask you to have decorum. Please don't yell, scream, act appropriately, which I know, ladies and gentlemen, you all will. And we look forward to hearing your comments and then moving forward to a interesting presentation, which I think we're all going to be obviously very much engaged with. I understand that there are people downstairs as well, and I can't tell you how excited and happy I am that you've all taken time out of your day to participate and listen to the county board. It is an honor to have you all here, and it is a privilege to serve all of you. And I think I can speak for all 24 of us. Thank you for taking the time out to be with us for this very important decision that the board may be making for Kane County. So with that, the first speaker I'd like to bring up is Kathy Flesberg. Is Ms. Flesberg here?
Yes, I am. I'm downstairs.
Oh, very good. Welcome, Kathy. You are our first speaker to speak downstairs.
Well, thank you very much. I'm here to address some of the concerns I have with the 76-page Ernst & Young.
Kathy, I'm going to hold you just for a second, not on your timing.
Okay.
I want to get you on full screen. There you are.
Hello.
Hello.
So I can go now?
Okay, from the very beginning.
Okay. I'm here to address some of the concerns I have with the 76-page Ernst & Young risk assessment that was done for Kane County, for the Kane County new health facility. It's dated January 8th, and I know the public has just got this within the last couple of days. So I don't know when the board was given this, but I'm extremely confused as to why this report is addressed to Susan Feinstock, who's the village president of Maple Park, but she was hired as a temporary employee back in 2021 for a couple of months, and she worked less than 350 hours. And in fact, her husband's the IT director. Her employment was from March to May of 2021. So I'm really confused. Was this started back in 2021 when she was an employee of Kane County? Or, so I don't know, are some of these, like the 40 million, is that back in 2021? Because prices have sure gone up in the last 2 years. In fact, they've gone up almost 30%. I think if the county hired Ernst & Young to do a risk management report, that this would have had to been voted on by the board. And again, I'm confused. They did this report from September 2023 to January 8th of 2024. So when did we vote on the appropriations for this? Because this was not a cheap report. I'm going to put this, for being a quarter, this is at least $50,000. So where's that money coming from? We don't have any money from the state yet. This hasn't even been approved. So did the board appropriate this money, or was this done behind our back? I can't say because I wasn't here last September, August, or back in 2021. Who knows when you guys started, when you started this, Corinne, because I'm thinking that Susan worked for you. So this was between you and Susan. I'm thoroughly confused when I read this report over. First, let me start with where you're placing the facility. You're moving it from Aurora, where the majority of the residents are low-income families, and these are the majority of the people that visit this facility. And you're moving it to St. Charles, which is middle to upper class. They don't need it, they don't require it, and they don't want it. But you're saying that you're putting it in the center of Kane County, but you're moving it away from the low-income people that really need it. A lot of work, I see that a lot of work needs to be done by the county in order to get this approved by December 31st of this year, which is a requirement of the US Treasury. And in fact, all the money, if you are approved, all the money needs to be spent by December 31st of 2026. And I mean, if we are going to get approved, what about an architecture? I mean, you don't even, how deep are we into this that we don't know about? I wish the board was much more transparent. Corinne, I wish you were much more transparent. Getting back to the report, it states that the facility is going to be $40 million, with $20 million coming from the ARPA SLFRF funds. But my math isn't adding up to 40 million. I wish I knew how you came up with the 40 million. Like I said before, prices have skyrocketed. You're taking 5 million from the health department funds. You're taking 6.5 million from the state and local fiscal funds. And then you want 20 million from the US Treasury. That's 31 to 32 million. So we're 9 million off. If the 40 million was calculated in 2021 and prices have gone up 30%, now we're another 12 million off, which is 21 million off. So where are the extra funds going to come to build this facility? And in the report, it states a couple of times that if it's determined that the county doesn't fit the criteria or comply, that the county would have to pay back whatever money the US gives to them at the current market value. And then really quick, I want to touch base on compliance. Nothing in this report, nowhere does it say anything about family planning.
Kathy, thank you. Kathy, thank you so much. Thank you. Your 5 minutes is up, ma'am. Thank you. Appreciate your comments.
Okay, and then you're going to quarantine us and turn me off, I bet.
The next speaker is Dan Barrero.
So I don't need the timer. I don't need the timer.
Yes, we got the timer.
Okay, great. Good afternoon, Madam Chair and County Board members. My name is Dan Barrero. I reside at 795 Bluebonnet Court in Aurora. I'm a 55-year resident of Aurora and Kane County. And I'm here today to speak about the Kane County Health Department, not the facility, but the department. And so first I want to say kudos to all of you members for your service and for keeping Kane County government running. being in public service is not easy. And unfortunately, politics gets involved. But on the good side of it is that Kane County has very good professional staff, and they do a good job. Purpose of county government is to provide for the health, welfare, and safety of our residents, and also to improve the quality of life. And that affects all of us. The Kane County Health Department is a key driver in improving the quality of life for our residents. And I may note that the Kane County Health Department is award-winning. How do I know? Because I've been involved with the Kane County Health Department in a lot of initiatives over the years. For maybe 20 years, I was involved with the Kane County Fit Kids 2020 plan. And during that time, I got to meet Mike Isaacson. Mike Isaacson was in the trenches, professional staff, many other staff members doing a great job for the residents. And during that time, I learned that our children's life expectancy is going to be less than our life expectancy. I learned that childhood obesity was epidemic. I also learned that chronic illnesses were on the rise. And we also got to see where these things were taking place, had the most impact, adverse impact. And that was in my neighborhood, or my part of Aurora. So that's why I became involved. To me, this was shocking news. You can see the proliferation of people using more prescription drugs, medications. We can see dialysis centers. And so we developed a plan, developed best practices. We got involved with the Top Healthy Chef competitions to get kids engaged, understand how they could eat better. Community gardens, farmers markets. We had mini grants to provide many programs throughout the county. We had a mind shift with a lot of programs that were already in place. Very simply, just taking a program like the Sports Festival at the City of Aurora or summer school, and then making sure that we had healthy meals for kids. These were the benefits of the Kane County Fit Kids 2020 plan. I was also involved with the chip and the cha. You may wonder what that is. Some of you know, right? Dr. Silva, the King County Health Improvement Plan and the King County Health Assessment. And so with that, we had many people throughout the county that were involved. We had dozens of people involved throughout the county because we all cared about improving the quality of life of our residents, improving the health of our residents. So we have a lot of things in common. So, you know, the King County Health Department also created the website. I don't know if you've gone to it, but it has a lot of good information there. A lot of organizations use it to get their data, and it's a good resource. And it shows you where the disparities are and you know what the needs are. And so, you know, the goal when we were involved, the King County Health Department, in developing these plans, the goal was to have for King County to be the healthiest county in the state, and we were making a lot of progress. Unfortunately, I retired and I kind of lost track of all this, but I know that the King County Health Department is in good hands with Mike Isaacson and the staff there. And I just wanted to come out here and say kudos to the staff of the King County Health Department for the great work they do and for making sure that they're taking care of our residents. And it shouldn't matter what your zip code is. Your zip code should not determine or dictate your health. So I just want to say thank you very much.
Our next speaker is John Hull. Is Mr. Hull here?
Yes. Yes, I am.
All righty.
Thank you for allowing me to speak here today.
Oh, hold on just a second. Let me pull you up full screen. And then we'll start you all over again. There you are.
Okay, thank you. My name is John Hull, and I'm a 51-year resident of St. Charles, Kane County area. Lived in 3 different homes here, and I currently have 2 daughters living here. So I am definitely committed to Kane County and very appreciative of the lifestyle that we've been afforded here. Over the years, we've seen a lot of changes take place, and that seems to be a part of what's going on here today. And what I'm particularly concerned about, and very much in tune with what our invocation was today. I've been attending a number of these meetings, not only the board meetings, but some of the supplemental meetings and committee meetings. And I want to share a concern that I have. And it relates to today's topic, obviously, but it also related to a topic in which, as a number of people come, this last week, I was attending this a session on our sanctuary discussion as it relates to Kane County. And a number of people were there, and then several of the board members commented afterwards. And I was very disturbed that one of the comments made by a board member was that some of the comments were divisive. Well, in the way I understand this works is that we're here representing our beliefs, our feelings as constituents and taxpayers in Kane County. Lord knows we pay taxes, and that's our duty to do that. But I don't want to be able to sit here and listen in support of either some ideas or another and be subject to being accused of being divisive. So I'm not here to be divisive. I'm here to listen to both sides of whatever these stories are as it relates to what is best for Kane County. And I was at one session where there was 3 people that were on one side, and there was about 40 on the other. And all I'm saying is that I hope you as board members, as you listen to what was said in our invocation today, are open to at least considering what other people are saying about how they feel and what they see as what is important to them as individuals in this county, and what really is a benefit to their family. But irrespective of that, to make sure that you know that I'm on topic, I'm not going to take my full 5 minutes because there's others that have things to say. But I am definitely not in support of building these buildings just to house other facilities where we can spend some of that money more effectively on servicing people today, now, that need our services in the health services department. And that we don't need a big fancy building that are going to be hiring more and more people and thus raising our taxes again. So for that point of view, I encourage you to at least listen. And if you see there's 40 people that are clapping, well, maybe they have an approval of the concepts being delivered and aren't considering themselves being divisive, but they're trying to make sure that in your heart of hearts, that you could perhaps consider that there are other viewpoints that are maybe contrary to each of you as board members, but as constituents, we have a right to be able to be here and express ourselves. Thank you very much.
Thank you, Mr. Hull. There is Jan Hansen.
I'm here.
There you are. Thank you very much. We'll pull you up full screen. There you are. Okay, you're ready to go?
I am ready. Okay, I'm here on behalf of the Association for Individual Development. Madam Chair and Kane County board members, the Association for Individual Development, or AID, has a long history of collaboratively working with the Kane County Health Department. The AID Victim Services Program participates with Project SAFE. Our street outreach team dispenses Narcan and testing strips and is involved with the Overdose Awareness Opioid Task Force. The Kane County Health Department is a funder of these and other AID provided services. We have been involved for years with the Kane County Behavioral Health Council. Michael Isaacson spearheaded the effort to provide ARPA funding from the Kane County Board to the Big 6 behavioral health organizations in Kane County. AID is a part of the Children's Mental Health Initiative and successfully uses IRIS. Our children's mental health services, we've been able to reach individuals as young as 4 due to cooperation with the Kane County Health Department, which is much appreciated. AID greatly values our partnership with the Kane County Health Department and strongly supports the creation of a new and improved health department location. The demand for Kane County Health Department services has greatly increased since the onset of the COVID pandemic, but the health department needs an adequate central location from which to provide these services and expand their collaboration with community partners. Health issues occur in all populations throughout Kane County, and health department staff deploy across Kane County to offer clinics and vaccinations and vital public education and so much more. If the health department is able to be more centrally located, the valuable time of staff and public resources would be more effectively used. A large training center would be of use for many of the social services entities around the county and would also provide a venue to respond to healthcare emergencies or, God forbid, another pandemic. Centralized space would increase the ability to collaborate, pulling together providers in order to meet the growing need to address childhood trauma, creating opportunity to intervene and even prevent drastic outcomes. Large space that is able to be shared with the community at large would also assist in responding to the broader needs that impact public health, like affordable housing, hunger, employment, environmental issues, and other social determinants of health. AID is pleased to offer its support of the creation of a new state-of-the-art facility for the Kane County Health Department located in a more central location with space that could be utilized by its many partners and collaborators. We all benefit from a healthier Kane County. AID looks forward to the many benefits of this new location for the Kane County Health Department, for the vulnerable populations that we serve, and for our staff, friends, and loved ones who call Kane County home. This is on behalf of our President and CEO, Lori Baker. Thank you for the opportunity.
Thank you very much. All right, I'd like to move forward to people having some speakers who have come here to speak and signed up. Is Roseanne Erickson here? We're still on agenda.
Yes.
There she is. Welcome. Whenever you're ready.
Okay. I'm here to request that you vote no to the new health facility building that would cost $30 to $50 million. They don't have a phone, do they?
Pull it down, pull it down.
Hold on your microphone. Can you hear me?
Why don't we start her all over again?
Okay.
Start the 5 minutes over. Go closer.
Okay.
There you go.
I'm here to request that you vote no to the funding of the new health facility building that would cost $30 to $50 million, possibly. No one disputes the need for the valuable health department and all that they do. The request is the amount of money that it would cost for a building. I have read all the stipulations, or some of them, that are required in order to receive that money, with time schedules and various requests to be met. And it seems outrageous to be tied to all the limitations in order to receive the fund from the federal government. We taxpayers cannot afford this massive expenditure. The cost of commercial real estate is down everywhere. It is much more prudent and wiser not to use a huge 47,000 square foot building that would be essentially used as a call center, a warehouse, a meeting place, office building. 40%, I think, is for administration. We don't need a building, one centrally located building. We do need all those services. We do need the organization, but it doesn't need to be in one building. The idea of it being centrally located would benefit who? The people that may need physical access to the building are still a long distance away. Hospitals, acute care centers, medical provider offices are throughout the county. I am grateful that the Kane County Public Health wants to be supportive and helpful in every way to other providers. Visiting the website is impressive with all that is done, and even now with the plans to increase the days ahead. As the unknown future looms before us, it would be far safer to meet the changing needs by adjusting to the circumstances and the needs of our county as they change. We are a community of county and we are a county of rural and urban, which I love, but consequently, the fact that we need to change what we use the building for when we are required to pay back 20 million to the federal government, the future is just too uncertain. It's really a very uncomfortable fact. And my heart goes out to the younger starting families, the elder adults, those who are struggling to make ends meet, to meet the tax increases that we will all be experiencing soon. The tax burdens on our citizens are encroaching in every area, which does cause depression, which does cause decreased work opportunities. Families are falling apart. This increase in a tax burden, which it surely is not worth it. It's spending like there is no tomorrow. And is this what the federal government is believing? We have lived in Geneva for 26 years now, 28 years actually. The Kane County Board has been diligent and hardworking, and I appreciate all your efforts. I have been visiting the board meetings recently, since October 23, and viewing so much information on the website. So I am aware and grateful for all your time and decisions. Knowing that Kane County is one of the highest taxed counties in Illinois, please keep restraint in your spending decisions, and as we always have had to live within our budget. We've raised 3 children. We now have 6 grandchildren with the 7th on the way. Even more so today, my husband and I are tightly strapped and strongly desire and hope to continue to be part of this beautiful county. It is the best in the country. Thank you.
Thank you very much. The next speaker is Kim Cyber.
Hi, I'm Kim Sieber from Geneva.
Hello.
Just a quick thing. I have 3 grandkids here. They picked this on a spring break, so it doesn't make it easy. But I wanted to see the reason, because obviously I'm older. Why am I doing what I do? It's for the grandkids. You know, we have 5 grandkids, and I don't see things going in a better direction for them. I can't imagine the debt and the price of things that they have to incur that we've all spent the money on. So if you think of anything, think of the children. Also, for people who are needing the health services, why not do a lot more in-home? Because then you can see some of the other issues that might be included into why they have this problem or this problem or this problem if you did in-home. I mean, I grew up, because I'm old enough, the doctor came to the house. I know, cheap, $20, no big deal. But now, going someplace, some people might have transportation issues. Everything is so expensive. So why not doing more in-home training or things like that that would be helpful? I know our son and his wife, being nurse practitioners, they had to do that as part of their, you know, before becoming nurse practitioners, taking the test and all. So I thought that was imperative that when they did that, you know, so there's a lot of ways to work around this. A new building with more money and more taxes doesn't do any good whatsoever. And we've got so many facilities that are not currently being fully used right now that we could utilize. Just use what you have. I mean, I'd love to have a big addition on my house, an indoor, outdoor swimming pool. I don't have funds for that. You've got to have to live within your means, but we're asking you to live within our means, and our means means not more taxes. Thank you.
Thank you very much. Mr. Ross, I believe we have time for one more speaker. I think that's accurate. 7 minutes. All right. So he's our timekeeper. 8 minutes. Perfect. Perfect. So we do have time for 2 more speakers. If we could hold it up to 4. Mr. Anderson, I see you're hovering around there. So you can be our next.
Well, I'm just walking up because when I walked in, your associate said you're the first on the list. So I'm just wondering why I wasn't the first to speak, but I'll back off for a minute.
Mr. Anderson, please, your turn.
Thank you very much. Brian Anderson, Sugar Grove, Illinois. You've heard me speak here 4 times on this topic. I'm not going to regurgitate. What I do want to do is I want to thank Mr. Sanchez, Jared, it has been a long road. You have been working on this ARPA funding since May 10th of 2022. And it's a battle. It is a battle, okay? I also want to thank Michelle Gums. I also want to thank Bill Leonard. And I also want to thank Rick Williams. Why? Because I just referenced a few Republicans and Democrats coming together and understanding the importance here. Prudence. I love Michelle Gums on this issue. Prudence. We've got to look at this and evaluate. And by the way, don't take a citizen's point of view. In one of the early committees, we understand that the ARPA is much more complex program and that the CARES Act, and that requires careful deliberation on how the money is effectively used and spent. We're asking you, fiscal responsibility. We voted you in. Fiscal responsibility and being prudent. This is one of those watershed moments. I could go off on many different directions on what's heading our way, but it's a waste of time. I also want to remind us, and I heard it from a few speakers, this morning I was kind of digging into the 774 pages back from Wednesday, February 7th executive meeting, and I dug into the Ernest Young report. The county is proposing 20 million. The county currently estimates that 74 of that proposed building square footage be used for public health activities that respond to a need caused by the exacerbated COVID-19. I don't know. 2 weeks ago, the CDC came out and said, hey man, same as the flu. Don't worry about it. 5 days are over. Don't need a mask. I see we have a board member wearing one. She can do what she wants. We don't need that kind of a facility for that. I heard this wonderful gentleman talk about how great the services were. I've been to the Aurora building many times. There's never anybody there. I've been to the Elgin location, and I'm often reminded there was a sign, and it's still there. Hey, there's nobody here. For 8 years, we're only open 1 day a week, and it's for environmental issues. I walked in, I said, I'd like a COVID shot. She goes, we don't do that here. Wait a second. It's on the healthcare building site. So we need to take our time, folks. Why? Because our consulting group that we've already paid $1.9 million to told us, if you don't get this right, the U.S. Treasury could require up to $20 million to be returned. If the county does not comply with the federal procurement requirements, there's issues. If the county cannot comply with the FLFRF, which those of you that like to know the acronym, that is really boils down to the state and local fiscal recovery fund that we got from the U.S. government. They panned out $350 billion during the COVID pandemic. So we have to use the money the way they want it done. We actually would be in partners with the federal government. Now, I can't speak for everyone in this room. We want less government. We have enough government out of DC. We have enough government out of Springfield. For municipality, I don't want more government at all. And I would encourage each and every one of you to read that assessment. This isn't Brian. This is your consulting group that you paid 1.9. They're saying, slow down. There's a lot of risks. Now, I've heard some constituents come up and say, let's do something smart. Let's find a building here in Kane County that we can repurpose and refit and use. And as I wrap up, that's my prayer and my hope that you make that decision, finding something very, very affordable. Thank you
sir.
very much,
Thank
Madam
you.
Chair.
Thank you very much. We have 4 more minutes, 4 more minutes. All right, I'd like to
4 minutes left.
hand sign. Thank you very much. It takes somebody who has already who has signed up in person. Is Kathy Slowert here? Slowwalt? I can't quite read the handwriting. It's
I am.
Kathy S. Showalter.
Kathy Showalter is right here. Thank you very much.
Are you downstairs, Kathy?
I am. Can you
Okay,
hear me?
hold on. Give me a second. There you are. Okay, ready to go. And I think we can allow her 5 minutes.
I am here. I am Kathy Showalter, been Kane County resident for all but 3 of my living life. I'm going to be 70. These are my 2 out of 7 grandkids that live in Kane County. I am thrilled to live here. However, you're pricing us all right out of Kane County. I currently have 3 of my grandkids moved in with me. Why? Taxes, government centers, all kinds of stuff that you find it in your heart to spend our money. Right. Inappropriate. I'm sorry, but it's time that we stop. We need to make room. We need to think about these young kids that are growing up with not anything really available. Okay, yeah, we have schools, we have libraries, okay, we have parks, lots of parks, okay, but we need foundation. And if my 3 boys that I raised in Geneva school districts, if they don't have the foundation to bring their families up, we're gonna lose them. We're gonna lose these little kids. And I don't think it's appropriate where you, as we elected you years ago, this is turning, okay? Hopefully it's gonna turn around, but we need to pay attention to the Kane County citizens, because why? We're here. We're here. And we don't want to go away, but you're pricing us out of Kane County. And that's wrong. That is wrong. This is our life, and this is what we want you to listen to. Please do not tear down buildings, build new buildings. Okay, we have facilities that will work. We have facilities that are closing, okay? We need to open them up, stand behind our forces, and let's go. Please vote no. Please vote no. Thank you.
Thank you, Kathy. All right, that does conclude our public comment. We have used our full allotment of time.
Ms. Showalter's was only 2 minutes, so we still would have 3 minutes if you want to give.
All right, looks like 3 minutes. Mr. Esposito, please. And then, sir, could you contain to 3 minutes if that's possible?
Thank you, Madam Chair. I will only take 2 minutes. I'll cut through most of what I wrote. There's one point. First of all, I don't think I've ever heard anyone who's against the building say that the health department is not doing a good job. I think they are. Okay. A number of us have concern about spending money. And this money in particular, the way I understand it, from what I've read, the federal government will become a co-owner of this building and could, in the future, determine what happens to that building, even if the county doesn't want that to happen. But one of the things that Mr. Anderson's report brought out that I would like to bring out is that, and this is something that was in Exhibit A, it said the information on the projected growth of program and square foot requirements was provided by the county. So the health department, I believe this indicates, is broken down into five or six different groupings. One is Division of Finance and Facilities. It indicates they have 8 employees. When the building goes in, and I'm taking an assumption based on the way this thing is written, they want to increase the employees to 12. That happens through all of the different divisions of the health department. So the net effect is, getting right to the bottom line, right now, the county information indicates there's 89 people. Am I reading that? 89 people in the health department. When the building is built and they have all the sections of 48,500 square feet, they want to increase the head count to 130. That's 41 more people. Do we really need 41 more people? That's a 46.1% increase in head count. So are we building this building to put more people in there to do stuff? If it's really needed, fine, go ahead and vote for it. But you could do it with rented space someplace else without spending $29.5 million that I see that's going to be passed in these resolutions. I think you really have to see what is the best thing for the county. And spending a lot of money and adding a lot of head count is not the way to do it. Thank you.
All right, that does conclude our public comment. And I believe we put those on file. Is that correct? Would you like to put those on file? Yes? Okay, so I have, yes, please. Oh, all right, we have all in favor? Aye. Okay, anybody opposed? No, very good. Okay, so now we are going on to our updates and
Madam Chair, what about off agenda?
we have no off agenda.
Okay.
No off agenda. That's right.
Thank you.
Oh, thank you. Otherwise, we'd have gone directly to off agenda. So we have a couple of speakers' presentations that I'd like to call your attention to. The first one will be brought forward by Mr. Isaacson. So Mr. Isaacson, the podium is yours.
Good afternoon, everyone. Michael Isaacson, Executive Director for the Health Department. While we're waiting for the presentation to come up, I just want to thank you all for the time and energy that's gone into this. I'm sure many of you probably have talked more about public health in the last year than you'd care to, probably over the last several years with the pandemic. But I'm really appreciative of all the different viewpoints that everybody's had, both from the board members and from the public. So thank you for everybody for being so engaged in this process. We've presented many times on this, so I'm going to be pretty brief with my comments today. Just a couple of key things that I want to review. In the upper left-hand corner, we have gone over what the vision and mission of the health department is, what we're here to do. As Mr. Barrow mentioned in his comments, our stated vision was that we would become the healthiest county in the state of Illinois. That's what we're here to do, is to support people. In the upper right-hand corner is just a copy of a slide I've shared with our funding mechanisms. And I think this is important because it shows that our programs are funded by grants. And so a couple of things that are important with that is every one of those is its own project. It has its own deliverables. It has its own timeline. That's not free money that we can do whatever we want with. And so with some of the questions and conversations that I've had with the board members, as we move forward, and we are self-sufficient at the health department, we provide a balanced budget. When grants go away, positions have to go away. That's how we live from year to year. So it's important to note, as with our grant funding, it's dependent on what grants are available. So we know topic areas, certainly mental health is going to continue to be an important area. But if we get an opportunity to apply for suicide prevention funding that comes from the state, or perhaps collaboration money that comes from the federal government, That depends on who's in office at different levels and what opportunities are available. But this isn't just money that we can use for whatever we want. So that's the way public health works in this country. So that's the way we've always been, which is fine. But I think that's an important point as opposed to other businesses or even other departments that may have access to general fund money. In the lower left-hand corner, I just reviewed our organizational chart for our health department. I just want to really emphasize how fortunate I feel to work with such a great team at the health department. And I think our residents can feel really good to know that we have dedicated, well-trained, excellent people who are providing a wide array of services to help people. And that runs from home visiting, which I'm a huge supporter of, as was mentioned earlier, going out and inspecting our restaurants, making sure that our well and septic systems are working, working on mental health, working with early childhood. We have people doing a wide array of services, and the people represented in those little boxes there do a fantastic job. In the lower right-hand corner, just as a refresher, this is kind of the essential services of public health. And the only thing I want to draw your attention to, number one, we assess. So we look and see, and this is ever changing, what are the issues that are impacting our community? A lot of the conversation that we've had here as part of this proposal has really been focused on those health issues that have been made worse by the pandemic. And I agree with the comment. It's nice to be moving past where we're not forcing people to isolate and do some of those things anymore. But we have had people who have suffered tremendously during the pandemic, people who have lost loved ones, people who have been homebound and isolated, and there are ongoing issues that this pandemic has made worse. We're hearing about it from people, and we want to provide more services to be able to help people. I also talked, and this is kind of our version of market analysis in public health. We do a comprehensive community health assessment every 3 years. We do surveys. We did over 2,000 surveys with our residents. We do focus groups. We meet with health leaders in the community. Those results are just coming out now, and I just got an opportunity to preview some of it where probably no surprise to people, the number one issue that came out was adult mental health, and the number two issue that came out was juvenile mental health. So this is just the preliminary data that we're getting. We haven't prioritized yet, so we'll engage all of you in that prioritization process. But the needs we're seeing, I've reported on suicide rates, I've reported on overdoses, we've shared information, and in the upper right-hand corner, looking at state's attorney data, looking at law enforcement data, looking at coroner data, we see that many of our families are struggling. There's more violence in homes, there's more crimes against youth, there's a lot more that's going on now that we want to reach in and prevent. But then also those crimes, when they happen, impact people over a lifetime. So we need to be able to intervene and help our other organizations in the community so that we can help our residents be as successful as they can. And I've talked about a variety of other data sources that we have, real-time hospital surveillance, certainly the infectious disease stuff. We're talking about measles now, even though we pushed it out of this country over 20 years ago, it's still something that's going on. We have increases in certain diseases around the community that we're keeping an eye on. Those take resources as well. I also, over the past several meetings, have shared the communicable disease cycle. So there's a host, diseases get into us somehow, and at different stages of the circle, we have an opportunity to intervene and stop. So we can make it so that we're not susceptible in this case. So if I don't want to get measles, the best thing I can do is to be vaccinated. If I wasn't vaccinated and I do get measles, now the next best thing we can do is to isolate me so that I'm not giving measles to somebody else who could become ill, right? That's our kind of communicable disease circle. I've also shared over on the right a similar approach that we use to behavioral health, and I used early childhood trauma as an example here. There's things that happen. We have opportunities to intervene at different places, and sometimes we can't intervene in time to prevent something. But if we're not able to prevent it, we do have an opportunity downstream to provide more supports and to help people work through things. And again, as a reminder, with adverse childhood experiences, people who experience more trauma earlier in life are more likely to smoke. They're more likely to engage in dangerous sexual behavior. They're more likely to use substances. They're more likely to have diabetes. They're more likely to have hypertension. There's literal biological changes that happen in a person, not just decision-making, biological changes. So if we can intervene sooner and support people, support our schools, support our organizations who are supporting our families, that's going to be very beneficial as well. So some of the new opportunities that we're looking at based on the feedback that we're getting from the community, and I won't read the whole list here, but these are different service lines that we're looking to either add or to increase in our community. One comment about the head count, this facility, the new facility for the health department is long-term. We're not looking to add 40 employees the day the building opens. This is something saying, okay, over the next 10 or 15 years, with population growth, with increased needs, with other services we'd be able to provide, over long term, what space may we need? Because if we build something, if we buy something, whatever the decisions ends up being, we want to invest in something for the future, because the worst thing you can do is move in and have outgrown it the first day, right? So that's a comment about that. I do want to draw your attention, though, to the key principles in the lower right-hand corner, and I'll repeat these. Our process is to be cooperative. We work with the other community organizations. We're not interested in kingdom building. We're not interested in competing with people who are already providing services effectively in the community. We want to help people. There are some cases as we work through and develop our programming where it may make sense for us to be a support for organizations who are already doing it. And there may be some cases where we, as a safety net organization, we may have to step in and provide something that potentially doesn't pay as well. Because if some of these services paid better, somebody may be doing it. But for us as a safety net organization, it's going to be important for us to step in and address those. Partnerships for efficiency, I think I agree with the comments that people make. We have to be good stewards of tax money. So anything we can do to share space, and what we've presented about having a centralized meeting place is something that really would be a benefit to our community organizations, where it would build in efficiency for a lot of different organizations. I already mentioned we want to be responsive to needs. So again, this ongoing assessment, looking at what's happening in the community and being able to respond to that. We see this as an opportunity to really build a hub where people can come, both the public and our community partners, that we can be a central site where people can go. And then again, just emphasizing this investment, this opportunity to have a new facility, utilizing funds so that we can better respond to what's happening with COVID. But once we do that, we're still living within our means. We still present a balanced budget every year. And I mean, this goes for the whole county as well, but we haven't had an increase in tax funding at the health department in over 14 years. So we are not contributing to anybody being taxed out of their homes. We have not had an increase in a decade and a half. So we live within our means. We only budget what we have available to us. And that's important. I think that's very important that we live within our means. So just a couple of closing comments. I mentioned that this is a hub where people can connect. Education, and this is harder. I think it's easy for people to understand, say a hospital bed, and somebody comes in and gets a service. But the way we provide public health support and the things that work, the evidence base for most of these interventions are around us working together with community partners. It may be around policy change. It may be around shifting to see what training opportunities may be available to people. Again, how can we support? Having a training space just seems like kind of a throwaway thing, but it's actually critically important that we have space where we can meet together with our partners so that we can build. The services, as I've mentioned, behavioral health, chronic diseases that people are experiencing at higher levels now. We had a lot of great comments from people during the pandemic that there wasn't enough emphasis on people being healthy before the pandemic, and that's true. So there's a lot more that we can do in there, and some of the services I presented on the previous slide where we can help people with chronic diseases like hypertension and diabetes, things that you don't get at the doctor's office, by the way. We know you can go in and you can get your medication, but changing how you cook, changing your physical activity, that doesn't happen at a doctor's appointment. That's more of a community service. And in some cases, we work together with the hospitals to provide that. So there's good opportunity there. And I already mentioned kind of in the cycle, if we can prevent bad things from happening to people, we want to do that. Sometimes we can't prevent it, so we need to intervene. Other times we just need to be able to respond and help people the best we can. I also was kind of struck yesterday at the CAL meeting as we talk about building out potentially a business organization for helping in Kane County. And it was an interesting lens, I think, for maybe policymakers to think of public health, that we're not necessarily opening a business. We're supporting businesses that are out there doing things. And it's just a slightly different angle, because I know a lot of times, as I mentioned, people say, well, how many shots did you give? Or how many beds are we going to have? That's not where the true benefit of public health is. That's part of it, but there's a lot more that goes on that's a little harder to measure directly, that goes with working with these community organizations so that we can have good outcomes with them. And then finally, we want to be able to provide for people all over King County. The idea of having a central site, again, works very well for our professionals. There's no way we would step away from Northern King County or Southern King County. So whatever option the board decides on, I'm going to strongly advocate we have to have a presence in those communities, north and south. That's never been on the table, that we were going to step away from those. And using home visiting as an example, I think this is something in our discussions here. We have talked about how the use of the building needs to meet certain requirements. But I want, and that's true, and I have no concerns about the use of the building meeting all the requirements that Treasury's laid out. But that doesn't mean that that is the limit of what the health department does. Yes, we want to do home visiting. Yes, we want to do more home visiting. Yes, we want to do telehealth. So as we move into the future, we want to meet people where they are. We want to get out into the community. So I wanted to make sure that we don't mix and match those two things. The building would be utilized for what would be acceptable, but then also that's not the limit of what we would be doing. And with that, happy to answer any questions.
Microphone is off. And I know, Mr. Isaacson, part of your presentation is we have guests here from Ernst & Young, and I know you'd like to have them to have an opportunity to speak as well. So would you like to ask questions right now to Michael before we go over to Ernst & Young, or do you want to listen to Ernst & Young and then go to your questions that you may have for Mr. Isaacson?
Mine is specific to Michael.
Okay, very good, sir.
Yeah. Mike, if I can, as we begin to peel the onion, if you will, time and time again, we're seem to be segregating into those departments or offices that are funded from the general fund, which as compared to those that are grant funded. Part of the confusion that I'm having, we want to beef up, we want to enlarge, we want to offer more from the health department. In your opinion, let's just say you have a new facility, whether that's rented or purchased, and you're going to beef up 100 people. In your mind right now today, is that because you've gone out and received more grant funding to allow that to happen? So the impact to a general fund is in the building itself.
Yes, and I mean, if with the funds here, it would be no direct impact on general fund other than maintenance, which is a cost certainly. But our expansion is based on what we bring in, and I think that answers your question directly.
It does, because the confusion when you go home at night becomes, gosh, if it's grant funded today and then the money runs out in 3 years, and now those employees don't have jobs, and how do you fund that? But that's the way you have typically operated.
That is the way.
Always.
Yes.
So I don't want to use the word anomaly yet, if it fits in this particular case.
Yeah. So I can tell you right now, we don't have space to expand. So we're not as aggressively looking to build out, and with comments about the Elgin building, I don't disagree with that. That is an office building right now. We would like to move where we can provide more services, including clinical services, up north as well. So that's something that we would pay for. We would be on the hook to get that funding. That's how public health is funded. I have said, though, at the beginning, we're the lowest funded health department per capita in the Chicagoland area. So I will continue to bring those facts forward. So I don't want to say I'm not, and that's independent of any building conversation.
I appreciate you. I appreciate your.
Okay. All right.
Thank you, Madam Chair.
Sure. Anybody else for Michael? All right, please introduce your guests.
All right, good morning, Roger Fonstock with IT and Buildings. This morning, we had invited Ernst & Young to come in and speak to the mitigation on risk assessment that you all have hopefully read and have received. So today we have with us Gary Burke and it's Mr. Miller. It's Will Miller, right? Got your names correct. Okay. But yeah, I'd like to introduce Mr. Burke, let him come up and he can speak to some of the questions or answer questions about the risk assessment that was conducted for the new building and also the mitigation. Thank you.
Good afternoon. Thanks for having me. Thanks for the introduction, Roger. So I sent over a few slides that I'll go through in brief detail that tries to encapsulate the rather lengthy risk assessment that we put forth this past January.
Could you get a little bit closer? That mic is just persnickety as I'll get out.
Thank you very much. Is that better? Okay. So this slide contains a very brief timeline of our involvement with the county. And just to give a reference of where we started and where we are today. So we started with the county in November of 2021. We were engaged. One of the first things that we did is we helped the committee and the then program manager set up an external grants program, community grants support program. Once that was out, we realized that there was a significant number of department requests that had to be assessed and vetted by the ARPA committee. So we endeavored with, and at the request of the former ARPA manager, to create a standardized process by which we could assess those projects for really compliance with the ARPA guidance. So that was started in, that was finalized in August 22. And we started the assessments, including the public health building triage in September 2023. Since then, we've done approximately 88 assessments of projects. There's still some that are in our queue, and we conduct those assessments at the request of the ARPA program manager. And in January 2024, we did complete the building assessment. And I think it's important to note that that represents more of an expanded assessment than some of our others. We did that at the request of the program manager to understand if the county, given the amount of funding, if the county did endeavor to take on the building project, what would be the execution and operational risks related to ARPA funding and the federal guidance related to Treasury funding. I want to give a brief background on the risk assessment process to frame how we endeavored to identify some of the risks associated with each project. On the left, I offer a definition of the risk assessment process and what it is and what it is not. On the right, again, briefly, we, at the request of the program manager, provided a template for his and the group's consideration. We got feedback from the working group, and at the time, the working group included not only the ARPA program manager, representatives from the SAO, as well as representatives from the ARPA committee itself. In late September, we did finalize that template, and we started to execute assessments based on that template. That template did include a categorization of risk, and I think it's appropriate to provide information that lets you know that the ARPA guidance in itself does not provide a definition of what risk is in any sort of quantification, whether that high, medium, or low. So we endeavored with the county to understand how the county would view risk. And so based on the county's information to us, there are really three types of risk. Low risk is where the project that's been provided is explicitly stated in ARPA. So think about a vaccination process or a separation project or contact tracing. Those are explicitly stated in the guidance as an appropriate project. There's also flexibility in the guidance to conduct projects and use federal funds for those that are not explicitly stated or for the guidance beyond those enumerated. And for those projects, we determined, again, with the working group, that if there was expanded documentation requirements set forth by Treasury, then those projects would receive a high risk measure. If there are no expanded documentation requirements, then it will receive a medium risk measure. Following that, we did develop a process whereby we went through everything in a very uniform fashion. We coordinated with the working group to have a work through approvals, ultimately providing our assessment to the working group, the program manager, and then that would go to through the process through the county board for the board's consideration. At the bottom right, there's a list of the information that we rely upon. You'll note that the information comes from the county. So when a department requests a project, the department requesting it has the responsibility to provide the information necessary to conduct the risk assessment. At times, there's a fair amount of iterative back and forth to clearly understand the nature of the project and how it would fit into the federal guidance. And the federal guidance listed is a brief list here, but if you care to go to those documents, they're quite lengthy in nature. So as it relates to the public health building in particular, this would fall under the capital expenditure requirements in the ARPA guidance. And I think it's fair to say that the guidance does allow for capital projects. However, if the project is not enumerated, which the health building would not be explicitly enumerated, it would be beyond enumerated. There are certain things that need to be considered in the eligibility. One is there needs to be identification of the negative public health impact, and two, the project that's being proposed and endeavored is responsible and reasonable to address the public need or the negative impact. If it is determined that that has been met, then the recipient, in this case, Kane County, has the duty to provide documentation. So the documentation is included on the right in the slide, which is a description of the specific harm and nexus to the pandemic, the appropriateness of the capital expenditure, some comparison to other alternatives, and then finally, those three items in a narrative form is required to be provided proactively to Treasury in each of the county's quarterly reporting to Treasury. In our assessment, as I mentioned earlier, this is an expanded assessment. So we looked beyond eligibility and into the actual process by which the county would need to procure the building, construct the building, and use the building, all with the mindset of what risk would present itself to the county if compliance was not met. And we attempted to quantify these things, but again, the guidance doesn't offer any clear definition of how much money would be at risk if a project was deemed to be inappropriate for Treasury's guidance. So under eligibility, if the county, I think for my latest understanding, it's $18 million. At one point it was 20 when the memo was written. If the Treasury did decide that that was not an eligible use of funds, the county would be on the hook to return $20 million or $18 million, however amount the county used for the project, would need to return that to the federal government. Also, during the procurement, if procurement wasn't done properly, and this is an area of high risk for any project, not just this particular project, if procurement wasn't followed per the technical federal requirements, the entire amount of the procurement or the project may be at risk, which could be a maximum of the total funding used for the building in this case. When we get into construction, the financial risk to the county is really the unspent funds at 12/31/2026. That's goes into, can you get the right contractors, the right permits, everything of that? Can you get the funds spent by the end of the spending period? And then finally, the utilization and joint ownership. If the county were to use federal funds, the federal government would be a co-owner of the building. And should the county change how it chooses to utilize the funds, say if it went from a public health building to just a warehouse, that may trigger disposition. Also, if the county chooses to dispose of the building down the road, that would definitely trigger disposition. And at the time of the disposition, the federal government could ask for its share of the then fair market value of the building. So in theory, the building would depreciate over time as buildings tend to do. So in the future, it could be less than $18 million or whatever the fair market value times the ownership percentage would be at that point in time. We looked at project eligibility through a checklist and mitigation efforts. You'll see the check marks of things that have been addressed by the county. These are the things that are required by the federal government to be included and documented in the submissions to the federal government should the county move forward with the building. You'll note that there's requires attention on the proposed capital expenditure to alternatives. This is really technicality. There's a word in the guidance that says independent. The county has done this from our understanding, but we're not sure how the county views the word independent in that guidance. So this is just an interpretation that needs to be made should the county move forward with this building. This shows some mitigation items related to the execution of the project. Again, it's the utilization, the ownership. The check marks indicate that we've had conversations, EY has assessed that and received information from the county and we understand that would mitigate the risk that's proposed by co-owning a building with the federal government. Similarly, with the construction expenditure, we understand that that may not be a problem based on relationships, based on the county's position, based on history. So that's what's been represented and mitigated to a point. And there's a lot of TBDs, requires completion. This is because we didn't want to endeavor to do any effort to assess any of these other risks beyond what we've already done, unless the building would move forward. So if the building would move forward, then we would get into more assessments and involvement in the procurement process itself, again, to prevent the misuse of federal funds and ultimately to mitigate the risk of returning those funds to the federal government. As a result of our assessment, and our expanded assessment, I should say, we did have several observations that we provided. There are 9 observations in these 5 areas and a related 22 number of recommendations. We've shared that with the county, and it's been reported to us that none of those recommended mitigation measures are currently contemplated to be a problem for the county, and that should the building move forward, those are things that all could be done bound by the county to mitigate the risks identified in these 5 areas. We were also asked to look into comparable projects. So as a recipient of federal funds, the recipients need to make reports to the federal government on a quarterly basis. Those reports are publicly available for anyone to go download. So we assessed the September 2030 data from Treasury and identified 9 buildings, 9 health buildings specifically, that have been used or are going to be used using the SLFRF funding. One in particular that we wanted to highlight is Peoria, Illinois, very close here to Kane. And you'll see the description on the slide, but it's similar to what we understand Kane's process and building intent would be. The reported financial data, their budget for their project is $16 million. They have contracts to make that happen of roughly $16 million. And again, as of September 30, they've spent $800,000 toward that building. So with that, I'm happy to answer any questions.
Second, there you go.
I do have a question for you. You said you identified 9 buildings or projects out of that were government entities, I take it, that received ARPA money. How many government entities received ARPA money?
1 second.
Throughout the United States?
Throughout the United States. I read, and I'm not sure about this, but I'd read somewhere, I thought it was 60,000.
There's 1,977.
Okay, 1,000, and that's throughout the United States.
Correct.
Are these 9 entities throughout the United States or just in Illinois or?
Georgia, Texas, New Jersey, Pennsylvania, Wyoming, and Illinois.
Okay, so the percentage of people using money comparable to what we want to use or more than we want to use is minimal.
I think on a percentage basis, that's a fair assessment, yes.
And how many were there again? 1,000 what?
1,977.
Okay, roughly 2,009 opportunities were utilized.
Mm-hmm.
Okay, so that works out to what? 0.45 1/100%? A little bit under 0.5%. Thank you.
Any other questions for Ernst & Young? Ms. Gums?
Thank you, Madam Chair. Michelle Gums here. Quick question. Of those 9 that you did the research on, it's been a conversation. How many are providing inpatient services? I think they call it butts and beds.
That level of information, I don't currently have. There's more expanded descriptions that I don't have with me at this time.
Okay. Also, can you indulge me in a little explanation of what proportionality means as it pertains to the final rule and our options, what we're required to do? Just give a little brief description of that.
Yeah, so I think you're referring to the proportionality related to the amount spent on the public harm created by the pandemic or the negative impact for health in this case. And so I believe what Treasury is indicating is that there needs to be a linkage between how many people or what class of individuals are affected and what the project would provide to that affected class. And so, again, using an analogy, if there's documented group of people, say it's in the hundreds, that have a particular impact, putting together a very large project in millions of dollars may not be the best use of federal funds. But on the other side of that, if it's deemed that the entire community, thousands of people in the community, then maybe that same project for millions of dollars would be appropriate.
Thank you.
Any other questions over here? All right, thank you
Madam
very much.
Chair, thanks,
Oh,
please.
oh, Ms. Bates, yes, please.
I'd like to ask a question of our guest. There are many rules when you apply for a federal grant. There's many rules when you apply for any grant. And in your experience, does it happen very often that a government entity such as ours would make a mistake like turning a health department into a warehouse and therefore having their building reclaimed by the federal government? Does that happen in reality or mostly on paper? Does that really happen?
Yeah, I don't have the data at my available fingertips to answer that question. But what I can say related to the pandemic is, especially with some of the earlier pandemic funding, a lot of the hospitals and health systems that were negatively impacted had to purchase ventilators. And the federal government had a very favorable perspective on those ventilators to say at the end of the pandemic, they've been used. And although there's a proportion of federal ownership of those ventilators, they don't want them back because they're effectively worthless. So I think
So
there's
the
been
federal
some.
government doesn't do takebacks usually.
In the example I referenced, the federal government did not
Yeah.
want those used ventilators back.
Okay, thank you. I believe that's more of the truth of the situation. Thanks a lot.
All right, Mr. Sanchez.
Thank you, Madam Chair. Blair, could you put up the presentation one more time? There is a slide that talked about sort of the risk and mitigation. I don't know what page it was on. That was towards the end. Yeah, go back a little bit more. No, go back. One more. Oh, we went too far.
That one.
Yeah.
Is that the one you want or the one
Yes,
before
this
that?
one, that one right there. Observation overview. Mr. Burr, can you kind of just spend a minute or so just kind of walking us through what the implications of all of this really is? Because you have observations, various levels of observations for each category, but then recommended mitigation measures. What does that mean for if we're going to go after this building? How does this impact that proposal?
Yeah. Thank you, Mr. Sanchez. So when we endeavored to do this, we made certain risk observations. So eligibility risk is the first one to bring to life, and that is the federal government may have different opinion as to whether this is in fact the appropriate use of ARPA funds. They can do that with any project, not limited to this project. And so our recommended measures would include what, based on the guidance, the county should do in order to comply with the federal requirements. We also layered in our experience as to documenting those interpretations, documenting those actions. So as an example, we recommended a multi-group committee, including the SAO and folks from finance, to putting together procedures that are monitored and approved on a periodic basis and have that process articulated and documented in the process itself approved into whatever formal structure the county would use and need, so that as people turn over, as generations change, presuming this building's owned for a long period of time, the county would continue to operate and mitigate the risk established by those procedures.
Okay, yeah, because I think that is something that's a big concern for board members is, the risks are there, we're aware of them, and your report helps us understand that better. So what's our response? What do we do about that? And I've talked about, the metaphor of you're going down the tollway and, the speed limit's 70, you're doing 90 and you don't have your seatbelt on. Well, there's a lot of risk there. If you slow down a little bit, put your seatbelt on, those risks go down considerably. So that's what I take away from this slide, is that we have identified what the risks are and we've identified what needs to be done to mitigate those risks and really put us in a place where, as long as we follow that mitigation plan, we're in pretty safe ground. Nobody can guarantee anything, obviously, but we can pretty safely say that we're okay going forward with this project as long as we adhere to that mitigation plan.
Yeah.
So
the other thing I'd add to that is just the intention behind the volume of recommendations is to really create a proactive record. So for whatever reason, Treasury, if they come asking in 5 years and 10 years, whenever they might have the ability to do so, there's documentation that was prepared by the county contemporaneous with making this decision and endeavoring this program. That's not having to be put together by people who weren't familiar with the activities in 5 or 10 years.
Yeah, thank you.
Okay, Dr. Silva?
My question was about 50% answered. If we can go back to the second slide, I am trying to get a better grasp on the risk factor. Regarding the risk factor, in order to have minimal risk, is there one right before that, Blair? Keep going, please. Here we go. Yeah. In order to be, yes, in order to be in low risk, do 100% of the programs that we engage in have to be these low risk programs, meaning directly tied to the pandemic? Or is there a certain percentage of these programs that will put us in low risk? The reason I'm asking is we do, let's say, environmental with restaurants containing foodborne illnesses. So that's not directly tied to the pandemic, but we still do that. And we're going to do that inside this building. What percentage of these low risk factors need to make up the total project?
Yeah, thanks for the question. The way that we've viewed this is aligned with how Treasury describes a project in its guidance and how it requires recipients like the county to report on that project in its reporting portal. And so, we believe that the risk is at the project level. So each project has its own discernible risk. That's why we perform these risk assessments at each project that's proposed by department and asked of us to evaluate. So right now, there's been no guidance on ARPA or the universe of pandemic funding that I'm aware of where the Treasury or the regulators have indicated that they're aggregating risks among the various projects to come up with some sort of risk for the recipient. Now, could they be doing that behind the scenes? I think absolutely they could be. But from what they've put in the public facing documents, the risk that we've articulated and we've evaluated lies at the project level.
Thank you.
All right, thank you. Anybody else?
Madam Chair, just one follow-up.
Yes, Ms. Gums.
Thank you. Earlier you had indicated that, that risk is it's not defined well. But you indicated that any project requiring that expanded documentation would be considered by you to be high risk. And this project, in fact, would require that expanded documentation. So just for clarity, this particular project would be high risk because of that expanded requirement?
Yes, and to clarify, the high risk nomenclature comes from the county's determination of that risk. So the high risk, medium risk, low risk that's not stipulated in the federal requirements or the guidance. So in order to do the assessment of the project and provide that feedback to the county, we came up with, including feedback from the county, how we define low, medium, and high risk. So it's the county's determination of that risk, not the feds in this case. But you're absolutely right. If the project requires enhanced documentation, then it is flagged for high risk per our assessment matrix.
Thank you.
All right, anybody else? Thank you so much, Gary. Well appreciated. Great presentation. So Roger, I think you're next.
We're going to give it a minute for Blair to get the slide presentation together. But my name is Roger Fonstock. I'm the Executive Director for Information Technologies and Building Management. And we're going to go through some of the history of this, a little bit of a recap, where we're at, and then we'll get to a point where we're going to be talking about the actual real property or real estate, and we'll stop there. We'll have to discuss where you want to go at a certain point. If we're going to talk about purchase or real estate transaction, we may need to go into a closed session, but yes. Yes. Yes, it's in the middle. Yeah. So we'll give him a minute, but just, the beginning of this is some of the recap, and it basically talks about where some of the various pieces of this started back when we started looking at, see if we got control. There we go. So going back to the beginning, when we had the COVID pandemic and some of the unprecedented challenges that the county faced, trying to occupy everything from commercial real estate to gymnasiums and schools, while we dealt with, the vaccinations and services that needed to be provided. Between 2015 to 2024, there were a number of facilities conditions assessments. We also did a needs analysis on existing facilities. And between the condition assessments and the needs analysis, there's a lot of condition issues and things that need to be addressed at the health department building in Aurora. We know that. There, as Director Isaacson had said, there's space constraints and challenges with having enough space for people to operate. So, some of the equipment, material storage, a lot of that is a challenge day to day. They have 18,500 square feet in Aurora at 1240 Highland, and I would tell you that it's relatively full. So condition, space, and then obviously the future projections from some of our assessments showing growth and expansion. And we have that same problem in other offices and departments as well. I think this one is probably the most challenging. So we did begin in 2023 a facilities master planning process, and during that process, the community health facility or the health department facility kind of rose to the top. Everybody seemed to have the energy to say that that was a priority, very high priority, one of our top priorities, shorter term, not long term, not 10 years. We need to be doing something sooner. So the county board members had conveyed that through us through a number of meetings. We've been taking that as a initiative to try and pursue ideas for what do you do with the health department building. There is a draft of the facilities master plan. It's going to be presented at committee of the whole. I believe we're going to be on there in April. So, looking at the times, strange times, indeed, they have the opportunity to use funding that we've never had. So you have the American Rescue Plan funding that was provided from the U.S. Treasury and the guidance. It also has some restrictions which are out there, and we've talked about the risk and mitigation, but there's also time constraints. The funds are required to be fully obligated by the end of this calendar year. I know there's discussion about whether or not the deadline will be extended. We don't have any guarantees, but essentially the message is that, you have about 9 months. Time is getting short before you have to have contractually obligated those funds. So that's a concern. We've been talking about different scenarios for the health department, and we've been referring to it as community health facility, but we're talking about the health department building. There's also been some discussions about, Elgin, Aurora, and the idea of services in the communities where the people are more densely populated, whether you call it a health facility or a hub or something where you're talking about the population centers, I think has been a consistent message from Michael Isaacson and the health department. We've also talked about the central location, the shortest average distance to the health department as a central location that has a lot of merit. There's also identity with being on a government campus, being around other government services, and the proximity to other government buildings has some value. We've also talked about, buying a new building or building a new building at the Judicial Center, buying a building and renovating a building in Aurora, keeping the Elgin satellite office, which is just a lease space. It's just under 3,000 square feet. They use it for field work and assessments. There's been discussion about selling and repurposing 1240 Highland, which is the current building, in that process. So if you buy and renovate a building, what do you do with 1240 Highland? There's also a discussion about buying and renovating a building in Elgin and maintain the current building that we have in Aurora and put some money into it to try and make that particular building more productive, more usable. So those are kind of the scenarios that we've been working through. This first scenario was it was actually discussing a new addition to 1240 Highland and renovating the existing building and keeping the Elgin lease space. In order to accommodate the 48,500 square feet that we've been talking about, you would need to build an addition of some sort to accommodate that kind of space. And when we talk about that space, the space would largely be for expansion of the current staffing and programs. And then there's also a need for a large community and public space. And that's what we're targeting with the additional space. There's been a lot of dispute about how much it costs to build a building like this. We're using a number of $600 a square foot. I know for some people that might be high, or they may think that is a high number. We've looked at comparable buildings with our architects that are built by government and surrounding communities, and that number seems to be average for government, health, administration buildings, new construction, site development, bringing everything in. So, you could look at renovating Highland. It's 18,500 square feet. When we talk about renovating, there's a difference between carpet and paint and then structurally tearing the walls out and rebuilding a building inside of a building. And I think it's important to note that when we talk about the health department building as it sits today, it's a lot of carved up space, a lot of private offices and space that was designed for a professional office building, not necessarily for like a programs and services office building. A lot of private doctor, dentist types of offices down a hallway. The other thing is maintaining the Elgin space. So in scenario one, if you were to make improvements to 1240 Highland, you were to add some space to the building, and then obviously you still have to maintain a presence in Elgin, and we're still not centralized, and the site may not support an addition. There's limited amount of real estate around 1240 Highland. The second scenario we've talked about is building a new judicial center campus that would be centrally located. It's only viable really with the ARPA funding. I don't believe this would be something that we would try to put the burden on the general fund. There was ARPA and recoupment, and health department has funds in a fund balance. We spent about 6 months doing the vetting process. We've done the written justification. We've done the review and the risk analysis. Thank you for Ernst & Young coming in and talking about that. We're in the point where we need to get some direction if you want to continue to pursue this. We do have a lot more paperwork to follow with the mitigation steps and other things. The reason for the reduced cost, I think a few people have commented on that. We were originally talking about a full build out of the 48,500. And what we were talking about was a scaled back shell space that would be in the 48,500. So about 30,000 usable space day one, with a shell space that we could actually use as the health department expanded. And that's the reason that the price is 30,506,000. The funds are still required to be obligated by the end of this calendar year. And again, we're looking at the recoupment funds that we have in the general fund, and then also the health department's reserve funds would be the balance of the $30 million. So that's scenario two. Scenario three was a community health facility buy and renovate a building in Aurora, keep an Elgin satellite office. Again, there's a lease on that. We're not owning it in Elgin. What do you do with 1240 Highland? Sell and repurpose it. I've had a few people kind of speculate what that particular property is worth at 1240. I don't think I want to get into that here, because if that's a potential discussion later, we'd want to probably get it appraised, maybe have somebody give us a broker opinion of value. The other part is moving all of the services into a purchased building. There'll be some transitional costs and some things associated with moving and running services while you move. But that's scenario three. Scenario four is what if you were to buy and renovate a building in Elgin and maintain 1240 Highland as a office in Aurora? I think it's important to note that Aurora is the second largest city in Illinois. Elgin's, I think, 6th or 7th. There are I describe them as our metropoles. They're kind of two population centers. You'll see a slide where we talk about how many people are within 10 miles of the epicenter of those. It's roughly half the population is within 10 miles of those two stars. either south or north. So we obviously want to be able to provide services in Elgin and Aurora. And, the last topic, it was, we really want to look at what's the average distance or for a person to get to the health department. Are we making them drive, an hour from the north or an hour from the south, or can we get that down to, a 10-mile distance? So some of the concerns or things that we've been considering, and this is just so you can kind of go through our thought process. Heidi Files, who's been working on this with me extensively, she's not here today. She's on vacation. But I'd like to thank her for helping put a lot of this together. General concerns, building new and renovating, both of those things are expensive prospects. They're not inexpensive. We do have the population centers, which I've talked about. We've been, every property we look at, we try to determine where the local transportation, PACE bus service, highway, intersections, those types of things. We've been looking at the O&M, the operations and maintenance costs. How much does it cost to take care of the building if you were to buy or build? One of the frequent requests that we get is for large meeting spaces. This is an example of that today. We do not have large meeting spaces for 100 people or more. We just don't have them. We don't have facilities to do certain types of services that require large meeting spaces. We're also struggling with storage needs. You'll find that we have storage in almost every nook and cranny of the buildings that we have. And we need to work on better means of storing both supplies and even furniture. I think somebody mentioned at an earlier time. Also parking lots and access for the public and ADA. Those are all chronic issues. I think many of you know that most of our buildings are beyond the age of the ADA Act. So we have a lot of challenges where they're grandfathered in. Other things that we deal with concerns and condition of the buildings, the mechanical systems, and that's everything in between. Roof, ceiling, the outer envelope of the buildings, the plumbing and electric. You see our capital projects list that we show you. It's a large list of things. Any new building or existing building adds to that. We have to maintain it. We also deal with things like the computer systems, low voltage data, security systems, everything you can imagine that goes into a building makes it far more complex than maybe just simply the carpet and the paint. So you have kitchens and break areas and things like that we have to work through, and signage, even a monument sign or signs to get people around. I know there's been a discussion about even signage at this campus. So, and finally, the O&M. Every building, has landscaping, snow removal. We have to clean and do janitorial, mechanical, just the maintenance of the buildings, not to mention capital depreciation and the types of things that fail or need to be replaced as they age. Security has been a top issue for a lot of our buildings. How do you provide the security you need for the employees and protect the public as they're here? And then utility costs, to drive the utility costs for every building that we have. We have 29 buildings in about 7 cities, and it's about 1 million square feet. We've been considering demographics. Where's the population center? What does that make up? Where's the Hispanic population, the African-American population? We've been looking at over 65. Where's the under 18? Where do we have any disadvantaged communities? Are we disadvantaging someone by doing something? In other words, just to make sure that we're not creating additional distance, additional burdens for people that already need the most assistance, maybe. So again, we come back to some of the time constraints. The funds need to be obligated for ARPA by December 31st. There's been 3 board resolutions that are on your agenda. They're related to building new. And, I would tell you that the time to develop a site plan and a building plan for the purposes of constructing a new building is very constrained. At present, if you were to do the site plan and the building plan, you would probably be voting on the contract in December of 2024. That's the bare minimum 9 months to get all of that work done, and that will be a tight time frame. So that's one caution that we have. And then we have, other potential options. If you're not going to build a new building and you don't want to just kind of resign or resolve yourself to just have 1240 Highland, We need to maintain 1240 Highland. And then there's a proposition of, Aurora or Elgin or somewhere in between buying a building. You would have to do some renovation depending on the condition. And those are all valid options. We've done a search over the last, let's say, 3 or 4 months. And a lot of things that came back did not meet our requirements. All those things that I was listing that we were looking at, buildings that were too large, buildings that were too small. And I think that's been our challenge, is that while if there was the perfect match, the perfect building to buy and renovate, I think that's something to entertain. But I think, right now we're kind of at the point where we need a decision about the new building. If that's something that you want to consider, not, we just need direction. And then we also have some updates for closed session, which are related to the purchase or lease of real property that we would need to go into closed session for.
All right, so before we do that, are there any questions right now, Mr. Iqbal?
Thank you, Madam Chair. My question is about the new construction option. You use 2 or 3 phrases. Number one, you said time is running out.
Mr. Iqbal, could you speak a little bit louder? Please bring the mic closer.
Yeah, first you said the time was running out, then you said it's a very constrained time frame. What if I say the time really had run out? I don't think we have viable time frame to build it, to do everything within the time frame of the ARPA. And I have some experience in construction. I don't know how many buildings you have done, 48 square feet, starting from scratch, nothing right now, and completing it and making sure that we do it. I would say the time has run out.
I can respond.
Please, can you respond to that?
I don't disagree with what his statement is. We're at the kind of that pivotal kind of time period where you either make a decision or you don't. And if you were to say you want to build a new building, we would do everything in our power and capabilities to get the plans done to do that. But I think that requires, an extreme amount of cooperation from this board and the staff and everybody to do that in 9 months. And as you all are aware, November is election season. It shouldn't have an effect on things, but you will have a November election, and then you will have a December, potentially new board members, potentially new. So then you start in December with, can you explain this to us again? Because we're going to vote on a really large project. And I think that's some of the concerns. We wanted to try and get this sooner. And I still think that on the outside limits, it's possible, but it would be difficult to do.
Mr. Dalvis, I see you have your hand up.
Yes, thank you. I guess first I'm reminded how fortunate we are in Kane County to have the excellent staff that we do. Bar none in the state or the country. People like Mr. Fonstock and Mr. Isaacson really do a great job, as do all our staff. And as I listen to them, talk about this project, this is a discussion that is not brand new. This is a health department that's been operating and talking to us, maybe without getting our attention, until now. So the sense of urgency that has, come to bear on this is this federal ticking clock of ARPA money. It's kind of like the John Q. Public family sitting down to talk about finances and some kind of large purchase and say, well, I thought we weren't going to do this yet. We're not ready. But I have a coupon. So if you take the coupon out of this equation for a moment, this is not the way that we would approach a project like this. And it shouldn't be now. And if we're concerned about losing out on, the $18 million, I don't think there's any reason to be worried about that. I'm sure that we could ask Mr. Sanchez for a list of other projects that his subcommittee has looked at. And if there's not enough there, come see us at the admin committee, where Mr. Fonstock and building management have identified and fully vetted a long list of things that aren't just we might do them, we are going to do them, and many of those would qualify. So I'm not suggesting that the discussion of, helping or looking at this issue and a new facility for our health department should stop. By all means, it's now had, light shed on it that was important, and this discussion should continue, and we should, come up with better answers, but do it in the right sequence of events and without this sense of urgency that's being applied to it unnecessarily. So when we get to the part where we vote, I will be saying no, and for the reasons I've outlined just now. Thank you.
Okay, thank you. Yes, Mr. Williams.
Mr. Fonstock, maybe this is a better question for, maybe it's a better question for our folks from Ernst & Young, but let's say this body approves the construction of a new building. And you guys move heaven and earth to get this done. And for some reason, that building is not complete by December 31st, 2025. What, or 26, excuse me.
Yes.
What is the impact of that?
I believe contractually, if you're not done, you still have invoices to pay. The time runs out at the end of 2026. And those obligations would be the counties.
And not ARPA funds.
No. And there is to kind of follow along with that, the ARPA funds at this point, I think they're 18 some million. And part of that was the order of obligations of the funds. And, if you're spending money on the site plan, site improvement, site development, and you're doing the prorated expenses, for the spaces involved, you'd be spending the money in a prorated manner as well. So, looking at it, you'd get to the end of construction and you would have whatever the remainder is in each of those prorated areas. So it certainly would not be the 18 million at the end of 2.5 years. It would be substantially less, but there is a retainer to close out construction, the checklist. We wouldn't want to pay people before their, work is done. So I think, 2 years is a good time frame for construction of a building. We've built quite a few buildings in that time frame. I've been a part of the multi-use facility, the multi-purpose building, the building of the jail, the sheriff's office, the gun range, development of the Kane branch court at Randall Road, a number of others, moving 911, demolishing. I mean, we've done quite a bit in 2 years of construction. Thank you.
Okay. Yes, Dr. Silva.
Thank you for the floor, Madam Chair. In addition to the prohibitive time constraints of a potential new building, I do want to address some of the public comments. A couple of which were very astute, in my opinion. One made previously at a different meeting for the use of these funds to do lead mitigation in homes or I'll call them visiting nurse home visits from nursing and staff to lower some of those costs. Would those types of programs put us out of the low risk category that we have?
I'm not an expert on ARPA, but I believe anything that's enumerated, that you're, following an enumerated use under the Treasury guidance would be favorable. It'd be seen as something that is directly related to the pandemic. So I see that being maybe in the, low risk type of category. I don't know. We have the experts here, but is that fair? Gary, I don't know if you want to, something enumerated.
Yeah, Roger, I agree. I just want to add one complexity for full disclosure. I think the eligibility risk is one facet of the risk that we described for any project. So it could be, if it's enumerated, it could be eligible. However, if in the execution of the project or in the procurement, as I mentioned earlier, if that is done in a non-compliant way, the funds would be at risk. So you have to evaluate not only is it eligible per the guidance, but what is the county's ability to comply with the requirements for 2 CFR 200 for the life cycle of that project.
Okay, and if they're not directly enumerated, it puts us in a higher risk category. I understand the government is giving us parameters, and we're kind of assessing our own risk because we want to be within those parameters. But I did want to address that if that's even possible in terms of risk. Thank you.
Yes, Mr. Caius.
Caius? Yeah. are there other projects that would qualify for this? Would be, the enumeration would be something ready to go or closer than a 2-year time frame that wouldn't put us at a
Yeah.
serious?
I think that the
Use the budget.
size of the projects that you're talking about consideration are smaller in scope and certainly don't get the same level of evaluation and scrutiny that a building of this size. So the timelines would be shorter to do the evaluations, but you would need to get on that quickly and start approving of those projects. And Mr. Sanchez from the ARPA committee could probably speak to that. They have a list of projects kind of that people have suggested or applied or asked about. And I think that would all be for consideration.
And are those similar projects, just interject, that Mr. Davos spoke about as well?
They're across the board. There's a lot of variety. So including more investment in the county buildings even. Those are in there. Programs throughout the county. There's a lot of need. I'd just say, you know, still have
Okay.
to do all the homework and the evaluation and get it through ARPA. But
Okay, all right, very good, thank you. Anybody else? And I don't see anybody online. So at this point, I think Mr. Tepe,
Madam Chair, I move for this board to go into closed session for the purpose of discussing the purchase or lease of real property for the use of the public body, and also for the purpose of discussing pending litigation against the county.
all right, very good. Is there a second?
Comes will second.
Ms. Gums, second. Voice vote, please.
This one, roll call.
Roll call. Well, yeah, roll call, that's what I meant.
Okay, Ellen?
Alan, aye.
Okay. Bates? Ms. Bates? Berman? Doherty, Davis?
Davis, yes.
Ford?
Board, yes.
Gums?
Gums, yes.
Iqbal?
Iqbal, yes.
Juby?
Yeah.
Kenyon? Caius?
Yes, yes.
Leonard?
Leonard, yes.
Lewis?
Lewis, yes.
Linder?
Linder, yes.
Molina?
Molina, yes.
Roth?
Roth, yes.
Sanchez?
Sanchez, sure.
Silva? Strathman? Surges? Tepe?
Tepe, yes.
Williams? Young? Yep, passes.
We are now going into closed session. Ladies and gentlemen, who are our guests, make sure you take all of your items, please.
No listening devices left behind.
All
And
right, everybody online that is joining us for the closed session, please accept the online invite to go in. We cannot begin closed session until everyone has joined us. A reminder to those in the room that has also joined digitally, you must also join before we can begin the closed session.
Yeah.
So accept those invites, please.
Jordan, yes.
Can I get in?
Yeah, I mean, I haven't noticed any.
I'm sorry, Mr. Doherty, what was that?
I'm late. I'm asking if to get in.
He wants to get in.
oh, yes, Mr. Doherty, you're going to be in. Absolutely.
Thank you.
Why not? Why not?
I don't know.
You think about the presentations, they were.
They were fine. Very thorough and complete.
The minutes come out. You should correct that to say
Yeah,
that you weren't sure.
Sure.
Actually.
Did not say yes. That is. Oh, hit the button.
I think that the restaurant.
His answer was a little bit.
How Zoom works.
His answer was the number. The answer is over 30.
Too much. Not too heavy.
30.
duty.
Over 30.
Tomorrow,
I was gonna
land
say,
deck.
I read somewhere where.
Nothing.
I am still waiting for one online person to accept the invite.
Updates, yeah.
So what he was answering was 1,927.
Yeah.
Over 40.
I just want to like get in there and be like, hey, what can we do to make this work for you guys? Like have a
I just
political
wanted to make sure. 'cause
conversation.
When he said that, I asked.
Michael, you'll probably need to leave when we talk about pending litigation.
So, yeah, came out to me.
There is one online person that has not accepted their invite.
1,927.
No. My guess.
Thank you, John.
Every hour to get up.
I know, I don't do that.
Yeah, it's all.
Yeah, you wanna take care of that one? Do some kung fu drills. Come on. Yep, let's go.
Is there anybody hearing my voice that feels they should be in the closed session?
Right. You gotta be able to. You gotta be able to be right next to somebody.
Hey Blair, Mark Armstrong here. I was told to stand by in case I was invited, but I have not been invited.
I'm in the meeting.
Yeah.
All right, you are in open session.
All right, ladies and gentlemen, we are back in open session. Clerk, could you please call the roll? Ellen?
Allen, present.
Bates?
Bates here.
Okay. Berman? Doherty?
Doherty here.
Davis?
Davis here.
Ford?
Ford here.
Thank you. Gums?
Gums here.
Iqbal?
Iqbal present.
Juby? Juby here. Kenyon? Caius?
Vice President.
Leonard, are you in line? No. Lewis? Lewis here. Linder?
Linder here.
Molina?
Molina present.
Roth?
Roth here.
Sanchez?
Sanchez physically present.
Silva?
Yeah.
Bethman? Here. Surgis? Tarver is not. Tepe, are you here? Remote? Williams?
Phone.
Young?
Here.
You have a quorum. So we're Mr. Leonard and Mr. Tepe
Three. Yeah.
and Mr.
They
Tarver.
are not, yeah, three of them.
Okay, but we have a quorum in the room. All right, ladies and gentlemen, we have a consent agenda that has been placed in front of you. Would anybody like to remove any of the items off consent? Yes.
Madam Chair, I'd like to move all of them off of consent.
All three? Okay. All righty, may I please have a motion and a second?
Could I ask a point of information?
Yes, of course.
Do any of the three resolutions that we have, do any of them just apply to the potential new building?
I think they, all of
Specifically,
them do as presently drafted.
all, correct, all do according to the existing budget that has been proposed for the new building. However, each one can stand independently if you decide to make other choices.
And you could
Or,
amend,
or if I may, they can not be voted upon at this time to wait until other knowledge is brought forward.
So would that be a motion to table?
No, not postpone.
Postpone.
indefinitely.
Would there, along those lines, would there be one of them that we would kill or table indefinitely that would prevent us from then continuing with considering a new building?
Yes, sir.
building?
Please, perhaps Kathy Hopkinson can help clarify if I misstep on this, but it would be the resolution 24035. Isn't that right, Mr. Sanchez? Make it.
I would have
then-
to look.
Mr. Sanchez might be able to weigh in on that as far as the ARPA entitlement.
As far
That is 24035, which is in the amount of $18 million.
And that was specified for the new building.
Well,
Right. So
without having that funding available, we cannot financially move forward with the new building. Yes,
If I
sir.
may, Madam Chair, that's what I was going to say. That's really the decision we have to make right now is if we want to build new. If we're going to consider other options, then that's beyond the scope of this meeting. So I would guess we could just vote on 24-035 as that's the main chunk of ARPA funding and decide if this board wants to go in that direction. And if not, we don't even really need to call the other two up.
Surges would motion to table
we'd
24-035.
call them up first and then.
Well, you'd have to call it up first to
You have to
table it.
move it.
Can't we just call 34 and 35 together? Just
No, sir, we may not, one at a time, please.
I'll make the motion for 24-035.
Second,
To be, the motion
bring it up to discuss.
for discussion. Yes, please.
potential vote. Yes, potential approval.
Okay, so is there any discussion about 24035
I would motion to table.
I would second.
to table indefinitely?
Indefinite.
It would be postponed indefinitely.
Well, he can make a motion to.
Motion's to table.
We could just vote on it. We could just vote it down.
Yeah,
Or up.
could just vote on it. Just say no.
You don't have to do an
Easy.
extra roll call. We can just vote on it right now.
You can
It's
vote,
it's in our hand. We can do it.
you can vote.
Sorry, I was just clearing my throat.
Yes, that's,
I apologize. I would
we,
ask you to call the vote.
all right. No more discussion. Clerk, please call the roll.
Okay, I just want
This
to make
is John.
sure that I
This
had
is
it.
only on item, ladies and gentlemen,
24-035.
24-035.
And that Surges, you made that motion and Caius, you second?
Actually, it was Sanchez and Kyle.
As in Kai's.
Oh, I'm sorry. All right.
And this is to table indefinitely?
No, this is
No.
this is actually the vote,
Down.
to vote up or down. Okay, does everybody understand?
No. This is it.
Yes.
Up and down, yes.
All right.
Okay, Mr. Berman is fine. He's joking. Okay, let's get-
Ellen,
I'm sorry, is this a table?
Nope.
No, ma'am.
Oh, yeah.
No, no. Okay, we'll say it one more time. Everybody just
Down.
hush.
A yes
it's-
vote is to
I-
approve the resolution.
Thank you.
Okay.
A yes vote is to approve the resolution for $18 million. A no vote is to vote no to approve the $18 million funding. This would be for a potential new building,
Now there could be, is there any
new
discussion?
construction, new purpose-built building located in St. Charles.
okay, you ready? Miss Allen?
Not ready, please come back.
Okay. Bates,
Bates? No.
Berman,
Berman, no.
Doherty,
Already know.
Davis,
Davis, no.
Ford,
Ford, no.
Gums,
Gums, no.
Iqbal,
Iqbal, no.
Juby,
no.
Kenyon,
No.
Caius,
Yes, no.
Leonard, are you on?
Leonard, no.
Lewis?
Lewis, no.
Hang on 1 second. Linder,
Linder, no.
Molina,
Molina, yes.
Roth,
Roth, no.
Sanchez,
Sanchez, no.
Silva,
Silva, no.
Strathman,
Strathman, no.
Surges?
No.
Tarver, it's not here. Tepe, are you on? Mr. Tepe,
You go.
Williams,
Williams, no.
Young,
No.
okay, fails.
I go back
Fails.
to Alan.
Sorry, what?
Alan. Deb Allen.
I'm sorry, Deb, your vote?
Won't make any difference.
I'm abstaining. I still don't have enough information. Thank you.
Okay. I
Very
have
good.
you marked as abstained.
Okay, okay. All right, so that resolution now has failed, and will no longer be considered. What would you like to do with resolution 24-034?
If I might, Madam Chair.
Yes, yes, sir.
The vote we just took essentially makes the other two resolutions sort of moot. So I would just recommend we don't even bring them forward and call this meeting to a close.
But the,
No, no, no.
what,
I don't want to go home, but I want to get out of here.
I would like, yes, sure. Should we
How do you want to handle
postpone these? How about to postpone?
Well, I agree with
Microphone,
Mr.
please.
Sanchez. Sorry, Shepro. I agree with Mr. Sanchez. I think they are moot, and if they are not brought forward, then they're gone unless somebody puts them on a later agenda.
Surges motions to adjourn.
Makes a motion or a
Second.
second, then they're done.
Very good. Okay.
Ford seconds.
We got a second. All in favor?
All right.
Okay.
Aye.
Have a good night,
Aye.
everybody.